A very good afternoon. I'm audible?
Yes.
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 A very good afternoon, dear audience, and I am excited to join this very important webinar from India. I will today be talking to you about whatever I know, the important aspects of the principles of assessment, because assessment is the theme for today. So the goals of this talk are to understand assessment principles. The objectives are to enumerate the principles of assessment, learn terms used in the types of assessments, and enumerate the tools used for assessment of competence. What do we all want at the end of the residency program? We want our student, our resident, to be a competent ophthalmologist. What do we mean by competent ophthalmologist? Which means they have learned what is expected of them. How do you know what they have learned, what is expected of them? Only assessment will tell you. So why do we assess? Because we assess because it's important for patient safety and standards of care, to ensure we are training correctly and to develop trainees more holistically. How to get started with assessment? Well, we need correct tools. And correct tools really depends on the competence being tested. And assessment must also be based on certain important principles. So let's start with principle number 1. Time is valuable and limited. Most often, we and you may not get paid for teaching. So, clinical care and teaching becomes a balancing act. Hence, we need to have assessments that are neither too short nor too long, because too short may not capture the important information that you want, and for too long, we just don't have the time. So, the critical aspects need to be assessed so that one can move forward. Principle number 2. It's important to test application of knowledge and skills than just facts. If you want to know if your resident is good at cataract surgery, giving your resident an MCQ test is not sufficient at all. Hence, we usually need to use multiple instruments and multiple tools to test for competence across the spectrum. It also may be prudent to have multiple assessors who bring out different aspects in the assessments itself. Number 3. Principle number 3 is performance is situation specific. What do we mean by that? Someone who's doing great on a written test or an MCQ may not be that great in the clinic or the OR, and may not be that good with communicating with patients. So when you think a resident is a super resident, may end up not being that super after all. Principle number 4. Define the assessments clearly. Let the residents know ahead of time how often or how frequently they will be assessed, what is the competence that they will be assessed on, the method that will be used, and what is your expectations of performance of competence. Principle number 5. Make every assessment a learning experience. I'm sure many of you are familiar with these two terms that are important, a summative assessment and a formative assessment. So what are these two? A summative assessment usually gives a pass or fail at the end of the assessment, and typically done at the end of a course or rotation. No feedback is possible typically, and hence needs to be used minimally. In formative assessment, you can still make it formal, even though very often it's an informal assessment. It is typically periodic throughout the training period, and it gives you an opportunity for immediate feedback. In other words, it gives you an opportunity for teaching. It can also be a daily one, like a mini CEX, maybe just one point that you are checking off. And it is useful to do it multiple times over their training period. So where are we coming from? All this is according to Bloom's taxonomy. when we are doing assessment, we are testing these several domains, 3 important domains. Knowledge domain, which is the cognitive domain. We're testing skill, which is the psychomotor domain. And we are also testing behavior, which is the affective domain. The way we assess is actually built upon Miller's pyramid, the assessment of competence. So the educational basis is like this. So when you test, if your resident knows something, then you're testing knowledge. If you're testing to find out if the resident knows how to do something, then you're testing competence. And if your resident shows how he or she does it, then performance is being tested. And finally, when they actually do it in the workplace, then that is action. So here's Miller's pyramid showing knows how, shows how, and does, and the types of assessment tools or instruments that are used for each one of these. So for knows, we may use MCQs or oral exams, reports written by students, assess the capacity for clinical context application by essays, case-based MCQs, and assessment in control situation for OSCEs, simulations, lab practicals. And finally, when they actually do it in the workplace, then you do the assessment in the work environment, where you do the direct observation of the learner performance or portfolios. That is, and also something that we now increasingly call the workplace-based assessment or the direct observation. The 360-degree assessment also falls into this. So for an assessment to be really useful, the utility, there has to be reliability, cost effectiveness, validity, acceptability, and feasibility. Each one of these have to be thought about before you decide on the utility of a particular assessment method. So here is a poll for you. So we just talked about formative and summative assessments. So here the question is formative assessments. Select one answer. A, give a pass or fail score. B, should be used only at the end of a rotation. C, do not give an opportunity for feedback, and allow immediate feedback is number D. And what is your choice?
Okay, answers are coming in. Nina, you let me know when you want to see the results.
Right. So yeah, I think right about now, because I can't see that if the answers are coming in. So,
Yes.
So yeah, please go ahead and stop the poll. You can close it.
Okay. Yes, I'm now sharing the results. If you cannot see that on your screen, I can let you know.
I am not able to see it.
Okay. So the most answers chosen answer is the last one. Allow immediate feedback on performance.
Fantastic.
Yes. And one more was do not give an opportunity for teaching.
Well, that's precisely what the formative assessment does, which is in the form of the immediate feedback is actually a form of teaching. So yes, it does give opportunity for teaching. Okay, we move on and we'll complete the talk. So we've been talking about the characteristics of instruments and tools. And so what do we have out there? For summative, we have MCQs, OSCEs, quizzes. We have essay type theory answers and oral exams. For the formative, we have WPBAs, which are the workplace-based assessment, surgical skill assessment. We're going to be talking more about it today. 360-degree evaluation, faculty and program evaluation, which also we will cover later today. So we are going to touch upon this topic of using a rubric as part of an assessment tool. And what is rubric? It's an explicit set of criteria used for assessing a particular type of work or performance. So many of the assessment tools or instruments that we use today, the OCEX or the OSCAs, are all built around the principle of a rubric. So a rubric consists of dimensions, which is steps of a surgical procedure, and then levels from novice to expert, descriptors, precise behavior for each level. So here you can see there are the levels of, say, this is the ICU Oscar phacoemulsification. And here you can see that the levels are there on the y-axis. On the x are the various levels. The steps are in the y-axis. The levels of competence are in the x-axis, and then you can see the descriptors in each one of these levels. For example, if you talk of draping, and the novice is unable to start draping without help, and a competent, the lashes are completely covered and clear of incision site. I think Eduardo will be touching upon this in more detail. So what is this whole assessment, competence of, based on? It is based on Dreyfus model of skill acquisition, which actually defines that when to become competent, you go through stages of competence. So you have a novice, for example, maybe a little, a toy cycle for a child, and then a beginner who may then it's equivalent to say a cycle with training wheels, and then an advanced beginner, and then you have a proficient or competent, maybe somebody who actually races for fun, and then you have an expert, where not everyone reaches the stage or is required to reach the stage, but we expect our residents to at least go from novice to competent. Say the famous Romanian cycling champion Sergei Svesco would be an example for an expert. So that, now that we know what are rubrics, we're going to look at what are the instruments, what are the tools of assessment we have. For clinical WPBAs, we have OCEX, which is the Ophthalmic Clinical Evaluation Exercise, the PAIR, Pediatric Examination Assessment Rubric. There is the Mini CEX, is the DOPS, which is the Direct Observation of Procedural Skills, and CRS, Clinical Rating Scale, OCAT, which is for on-call assessment, CBD, which is a case-based discussion, and evaluation of a clinical case, and multi-source feedback. These are all to assess clinical competence of your resident in the workplace. For surgical skill assessment, we have several: GRASS, OASIS, OSATs, Oscar, and Eduardo will be covering many of these. And that takes us to the next and the last quiz for this talk. Eduardo, could we please have the quiz?
Yes. Just a moment. There we go.
So the question here is, which of the following is a workplace-based assessment? Select one answer. MCQs, OSCEs, OCEX, essay answers.
Okay, answers are coming in.
And you may stop the poll, Eduardo, at any time, because I can't see the answers.
Yeah, okay. Let us give us a little bit more, because we have
All
6
right.
answers out of 26.
Okay.
And okay, 7 answers out of 26. Okay, so I will end the poll and share the results. So the most chosen answer was number 2, the OSATs.
All right.
No, I'm sorry, the OSCE.
Okay. So I'm going to go back and look at the slide once more, because this is a very important concept for us to understand. So here you go. So I guess I went through this a little fast. So we are now talking about workplace-based assessment, and I think Gabby is going to talk a little bit more about it. So when we talk of workplace-based assessment, where you do direct observation, then the OCEX, so the Ophthalmic Clinical Evaluation Exercise, is up there at the WPBAs. The OSCEs are more a summative type of test, which is used in summative assessments. This distinction will become more clear as we talk more about clinical skills assessment. So to summarize assessment, a systematic procedure for measuring a trainee's progress or level of competence against a defined criteria to help you make a judgment about the training. This is, in summary, what an assessment is. Those requirements are defined in a competency model. To be valuable, competency models should contain only tasks and skills that are critical to success in the role. Remember, time is a big constraint. So do not include every activity that they perform in their job. You only have to define what skills are essential, what skills are critical. You need to define that competence to the resident before you test them for that. Thank you for your attention, and thank you, Eduardo.